Common trigger foods for people with acid reflux. Finding your triggers. Many people with acid reflux or GERD find that certain foods trigger their symptoms. No single diet can prevent all symptoms of acid reflux, and food triggers are different for everyone. To identify your individual triggers, keep a food diary and track the following: what foods you eat, time of day you eat, symptoms you experience. Keep the diary for at least a week. It's helpful to track your foods for a longer period if your diet varies. You can use the diary to identify specific foods and drinks that affect your acid reflux. Also, the diet and nutrition advice here is a starting point to plan your meals. Use this guide in conjunction with your food journal and recommendations from your doctor. The goal is to minimize and control your symptoms. 9 trigger foods cause acid reflux. Although doctors debate which foods actually cause reflux symptoms, certain foods have been shown to cause problems for many people. To control your symptoms, you could start by eliminating the following foods from your diet. 1. High-fat foods. Fried and fatty foods can cause the lower esophageal sphincter (LES) to relax, allowing more stomach acid to back up into the esophagus. These foods also delay stomach emptying. Eating high-fat foods puts you at greater risk for reflux symptoms, so reducing your total daily fat intake can help. The following foods have a high fat content. Avoid these or eat them sparingly: French fries and onion rings. Full-fat dairy products, such as butter, whole milk, regular cheese, and sour cream. Fatty or fried cuts of beef, pork, or lamb. Bacon fat, ham fat, and lard. Desserts or snacks, such as ice cream and potato chips. Cream sauces, gravies, and creamy salad dressings. 2. Tomatoes and citrus fruit. Fruits and vegetables are important in a healthy diet. But certain fruits can cause or worsen GERD symptoms, especially highly acidic fruits. If you have frequent acid reflux, you should reduce or eliminate your intake of the following foods: oranges, grapefruit, lemons, limes, pineapple, tomatoes, tomato sauce or foods that use it, such as pizza and chili, salsa. 3. Chocolate. Chocolate contains an ingredient called methylxanthine. It has been shown to relax the smooth muscle in the lower esophageal sphincter (LES) and increase reflux. 4. Garlic, onions and spicy foods. Spicy and tangy foods, such as onions and garlic, trigger heartburn symptoms in many people. These foods won't trigger reflux in everyone. But if you eat a lot of onions or garlic, make sure to track your meals carefully in your diary. Some of these foods, along with spicy foods, may bother you more than other foods do. 5. Caffeine. People with acid reflux may notice their symptoms acting up after their morning coffee. Caffeine may trigger acid reflux or GERD symptoms because it can relax the lower esophageal sphincter (LES). 6. Mint. Mint and products with mint flavoring, like chewing gum and breath mints, can also trigger acid reflux symptoms. 7. Sodas and carbonated beverages. Sodas and carbonated beverages are also common culprits of heartburn. Research suggests that these beverages may relax the esophageal sphincter and increase the acidity of stomach acid, 2 risk factors for heartburn. A study found that people who consumed carbonated beverages had a 69% higher risk of developing reflux symptoms like heartburn. 8. Alcohol. Moderate to excessive alcohol intake can also cause heartburn symptoms. Alcohol can do this in many ways. For example, it can relax the lower esophageal sphincter, which may allow stomach acid to escape into the esophagus and trigger heartburn. In addition, alcoholic beverages, especially wine and beer, can increase your amount of stomach acid, which can increase the risk of heartburn. Lastly, excessive alcohol intake may directly damage the lining of the esophagus. Over time, this can make the esophagus more sensitive to stomach acid. 9. Other options. While the lists above include common triggers, you may have unique intolerances to other foods. You might consider eliminating the following foods for 3 to 4 weeks to see if symptoms improve: dairy, flour-based products like bread and crackers, and whey protein. Making lifestyle changes. In addition to controlling reflux symptoms with diet and nutrition, you can manage symptoms with lifestyle changes. Try these tips. Take antacids and other medications that reduce acid production. Overuse can cause negative side effects. Maintain a healthy weight. Chew gum that isn't peppermint or spearmint flavored. Avoid alcohol. Stop smoking. Don't overeat, and eat slowly. Remain upright for at least 2 hours after eating. Avoid tight clothing. Don't eat for 3 to 4 hours before going to bed. Raise the head of your bed 4 to 6 inches to reduce reflux symptoms while sleeping. Thanks for listening.